Hello, everyone, and welcome back to the channel. If you've been paying attention to the news lately, you might have come across some alarming headlines claiming that Medicaid is ending in 2025. Understandably, this has caused a lot of confusion and concern, especially for those who rely on Medicaid for their health coverage. Well, I'm here today to clear the air and break down what's really happening with Medicaid in the coming years. So, let's dive right in. To start, I want to clarify something right off the bat. Medicaid is not ending in 2025. Despite what some of these headlines may suggest, the truth is much more nuanced. However, there are significant changes coming to the program that could impact millions of Americans, particularly those who depend on it the most. So, while Medicaid isn't going away, it's certainly going through a period of intense scrutiny and proposed reforms, and understanding those changes is crucial to protecting your benefits and your health. Before we get into the specifics of what's changing, let's take a moment to remember why Medicaid is so important. Medicaid is a joint federal and state program that provides healthcare coverage to low-income individuals and families. It covers a wide range of services, including hospital stays, doctor visits, prescription medications, mental health care, and long-term care. Without Medicaid, millions of Americans, including children, seniors, pregnant women, and people with disabilities, would struggle to afford healthcare. For many people, Medicaid is a lifeline. It provides access to care that they couldn't afford otherwise. But, as healthcare costs continue to rise and as the political landscape shifts, Medicaid is facing more and more challenges. The question isn't whether Medicaid will end, but how the system will change to address the growing demand for healthcare while managing the rising costs. Now, let's talk about what's driving the uncertainty surrounding Medicaid in 2025. While Medicaid is not going away, the program is being targeted for significant reforms and funding cuts. Some of these proposed changes have led to fears that Medicaid could be drastically reduced or that eligibility could become much harder to qualify for. The truth is, Medicaid is undergoing an overhaul, and the future of the program could look very different in the coming years. Let's break down some of the most significant proposals and changes that have sparked these concerns. One of the most controversial proposals being discussed is the idea of imposing lifetime limits on Medicaid coverage. What does this mean? Essentially, some policymakers are suggesting that individuals who have received Medicaid benefits for a certain period of time, perhaps 5 or 10 years, could lose their eligibility. This would have a huge impact on people who rely on Medicaid for long-term care or for conditions that require continuous care. The idea is that after a certain amount of time, individuals should graduate from Medicaid and transition to other forms of insurance or self-pay options. This concept is particularly concerning for seniors and people with disabilities who often need Medicaid for ongoing medical treatment and care. However, it's important to emphasize that these are only proposals at this stage, and the idea of lifetime limits has not been enacted into law. There is significant pushback from advocates who argue that such limits would hurt the most vulnerable populations. Many experts also believe that implementing such limits would lead to higher costs elsewhere in the healthcare system, as individuals who lose Medicaid benefits would still need care, potentially leading to higher emergency room visits or hospital stays. Another proposal that's been gaining traction is the idea of turning Medicaid into a block grant system. Under a block grant model, the federal government would give states a fixed amount of money to administer Medicaid, rather than funding it based on the actual number of beneficiaries. Proponents argue that this would give states more flexibility to manage their Medicaid programs. However, critics warn that it could lead to cuts in benefits or increased restrictions on eligibility because states would have to manage Medicaid within a set budget. This could result in fewer people qualifying for coverage or fewer services being provided to current recipients. This is particularly concerning in states that are already struggling to meet Medicaid needs. If block grants are introduced, it could have a major effect on the quality of care available to Medicaid recipients. States with limited resources may struggle to provide adequate healthcare services to everyone who needs them, potentially leading to longer wait times, limited access to specialized care, and reduced benefits. It's worth noting that many states are already facing challenges in providing quality care through Medicaid, and cutting federal funding could exacerbate these problems. Several states have already implemented work requirements for Medicaid recipients. These requirements mandate that individuals who receive Medicaid benefits must work a certain number of hours each week or participate in job training programs. The goal of these work requirements is to encourage self-sufficiency and reduce dependency on government programs. However, critics argue that these requirements could harm vulnerable populations, including people with disabilities, seniors, and low-income families who may be unable to meet the work requirements due to health or caregiving responsibilities. In addition to work requirements, some proposals are looking to tighten eligibility for Medicaid by requiring more stringent verification of income, assets, and other factors. These changes could result in more people being denied coverage or losing benefits because they fail to meet the new eligibility criteria. While the goal may be to reduce fraud and ensure that only those who truly need Medicaid are receiving benefits, the reality is that these new rules could leave many people who genuinely need healthcare without coverage. If you're currently receiving Medicaid benefits or are planning to apply for Medicaid in the near future, it's important to stay informed about these changes. While Medicaid is not going away, the program is evolving, and there could be significant shifts in eligibility and benefits over the next few years. Here are some practical steps you can take to protect your healthcare coverage. Stay updated on Medicaid changes. Keep an eye on news reports and government updates regarding Medicaid. Watch for announcements about proposed changes to eligibility requirements, funding cuts, or new work requirements. The more informed you are, the better prepared you'll be for any changes that may impact your coverage. Ensure your documentation is up to date. If you're already on Medicaid, make sure that your documentation is accurate and up to date. This includes providing the right income information, proof of citizenship, and any other documents required by your state's Medicaid program. Being proactive about your paperwork can help prevent disruptions in your coverage. Look into alternative coverage options. If you're concerned about losing Medicaid benefits or having your coverage reduced, you may want to explore other healthcare options, such as the Affordable Care Act, ACA, Marketplace. The ACA provides subsidies for low-income individuals to purchase private health insurance, which could help fill the gap if Medicaid benefits are cut. Reach out for help. If you're having trouble understanding how these changes might affect you, don't hesitate to contact local Medicaid offices or advocacy groups that specialize in healthcare access. They can provide guidance, answer questions, and offer support if you need help navigating changes to your coverage. In conclusion, while Medicaid is not ending in 2025, it is undergoing significant changes that could affect millions of Americans. Proposed funding cuts, lifetime limits, and eligibility restrictions are all part of ongoing discussions aimed at reforming the program. These changes could make it more difficult for many people to access the healthcare they need, especially those with chronic conditions or disabilities who rely on Medicaid for long-term care. It's essential to stay informed, keep your documentation up to date, and be proactive about exploring other healthcare options if necessary. While these changes may create uncertainty, there are steps you can take to ensure that you continue to receive the care you need. Remember, Medicaid is here to stay, but its future is still being shaped, and it's up to all of us to stay engaged and make our voices heard. Thank you for tuning into today's video. If you found this information helpful, be sure to like, comment, and subscribe to the channel for more updates on Medicaid, Social Security, and other important topics that affect your health and finances. And, as always, if you have any questions or concerns, feel free to leave them in the comments section below. I'm always happy to help. Until next time, stay informed, stay safe, and take care of yourself and your loved ones.